Hello, this is Dr. Kent from mychronicpain.com. Today, as a part of our series on interviewing experts in chronic pain, I have the honor of interviewing Dr. Kim Kristiansen. Dr. Kristiansen is a chronic pain expert, an advocate for those in chronic pain, and an educator for those in chronic pain. He is a physician in Denmark, a Harvard-trained pain researcher, author of The Empowered Patient, inventor of the DoloTest, a quality of life test for those with chronic pain, and he is a blogger and founder of the and director of the Evidence Profile apps. He is very involved in chronic pain, and we're very glad to have him today. I welcome him, and first question is about your book, The Empowered Patient. I'm very interested to hear how you decided to write it and who would benefit from it.
Yeah, well, I started writing the book with the purpose of writing it both for healthcare professionals and for pain patients, chronic pain patients specifically, but pain patients in general. But somehow I found out that that was quite too broad a target group. So I narrowed it down and wrote it specifically for persons living with pain. But to be honest, healthcare professionals are more than welcome to look into it as well, because what it's all about is we have quite a substantial knowledge about pain and pain management and pain mechanisms today, but healthcare professionals have learned, well, not much about pain. That's a universal problem. And we need to distribute that information, that knowledge to come to patients to that perspective and to be used in pain management for patients. So my idea was, well, at least those who live with pain need to know more about pain, and it was kind of a process. It started with the idea that we need to make pain management better in a broad perspective, and I, together with two colleagues, have developed a pain assessment tool, a quality of life and assessment tool, which is scientifically validated. It's called DoloTest and is now used in clinics more or less around Europe and also some place in US. And that was the basic part of it. And taking it from there, I wanted to write a book that people living with pain could learn about what it is they are experiencing, and from that perspective have some kind of platform to develop from.
Well, once again, I'd like to say how much pleasure it is to interview you today. And I'd like to say many people don't understand that pain professionals should treat to function and quality of life, not merely pain. I'm very interested in your test, the Dolo test, and can you tell me more about it?
It's a quality of life. It is actually validated against what we call SF36, which is short form. 36 stands for the number of questions, and we did that some years ago and published it, say, in a scientific journal. The idea of DoloTest is that it is unique in that it presents the test result visually, not just a number meaning something to the physician, to the healthcare professional, but a visual presentation enabling anyone, virtually anyone, to see and acknowledge the test result, and how things like pain, sleep, mood, functional abilities, social connections, things like that are working together to contribute to what we call the quality of life. So you get both an assessment on each of these parameters, but you get the whole picture as well, what we call the quality of life. And it is presented visual and it's available right away. It's kind of the way it is designed. So the idea was to allow the patient to take part in the interpretation of the test result, and from that set goals for the treatment and be part of evaluating response to treatment. So if you get some kind of treatment, say you go to a physiotherapist or get some kind of pharmaceutical or engage in mindfulness or whatever it is, you can, as a patient, together with your healthcare professionals, um, see the test result and evaluate response to treatment, see if you are where you want to be or how you can adjust to it. So it's kind of letting the patient be part of it, which is what I wrote the book for as well, called The Empowered Patient. I want patients to be empowered to take part.
So, how do you get the opportunity to use this pain tool?
So if you're a patient, the way we use it today is that clinicians sign up for using it. It's an online tool. You can sign up for it, and you can use your computer at home or work or in the clinic to make that score. So you need your pain professional, healthcare professional to use that tool, and clinics are using it in some perspective. But right now we're working on an app. It's obvious to make it an app, and it will be out, I guess, somewhere in early fall or in the fall this year. We're testing on it, and we are just about to make the next test round, and we of course would like some pain patients to take part of that. So you are welcome to find me on Twitter or on Facebook, and follow me there, and then you will know, and I'll ask when we need test patients, so I'll test persons. So please do that.
I really admire your blog. I find it very helpful, and it helps me keep up with some of the new things that are going on in chronic pain. Could you tell me more about your blog, Pictures of Pain?
Yeah. So what I'm trying to do with my blog called The Picture of Pain, pictureofpain.com, you can find it there. And it's because DoloTest is creating this visual presentation of the test result. I thought it is a picture of living with pain, so I gave my blog the name Picture of Pain. And what I'm trying to do there is describing some thoughts about pain management, and trying to present data with new studies, and commenting on those new studies. How do they fit in, and what is useful, and are they done correctly, and will they contribute with some interesting, some important information for patients as well. So it is basically for patients, but indeed for healthcare professionals as well. And if I look down on my readers list, I think it's some kind of 50-50.
You say you're going to have an app soon. Tell me more about that.
Well, we're working on that app. That's what we're doing right now, and it's quite a process because we need to test it and find out, is it the way people living with pain, is it what they want? And we make adjustment. We'll make these test rounds, and out for one more in a very, very short time. So we make adjustments and see if it is fit in for the need for pain patients, because that's who it's made for.
Well, that's all the time we have today. I'd like to thank Dr. Kim Christiansen for coming on with us for our blog feature on mychronicpain.com. This is Dr. Kent signing off. Better days now and better tomorrows. Take care.